What is it that doctors listen through the stethoscope? Let's understand. The first is heart rhythm and valves. We listen to how fast or slow your heart beats, whether the rhythm is regular or there is any extra sound called murmur which can represent the valve problem. The second is how your lung moves air. In the back and chest, we listen to airflow in your lungs. Clear sound, crackles, wheeze, or no sound at all represents infection, asthma, pneumonia, or lung collapse. The third one is about infection and fluid. Crackling or bubbling sound represents the presence of pneumonia or fluid accumulation in your lungs. If there is absence of any kind of sound in your lungs, then it represents there is blockage in airway. The fourth is gut and blood flow. On the abdomen, we listen to bowel movement sounds. Over arteries, we sometimes listen for normal whooshing that hints at narrowed blood vessels. It's just a small tool, but with a lot of information. In about 10 to 20 seconds, it gives you a clue regarding the upcoming disease.